Oral ulceration related to viral infections. 1. Herpes simplex virus, HSV1. Herpes simplex type 1 causes primary herpetic gingivostomatitis, affecting children and young adults, transmitting via direct contact with recurrent skin lesions or infected saliva. Starts as multiple small vesicles, which rupture leaving shallow ulcers. Affects gingiva, buccal mucosa, palate, tongue, lips. Clinical features: pyrexia, malaise, painful mouth and throat. Associated cervical lymphadenopathy. It can be treated with acyclovir or famcillover if started early in the prodromal phase. Recurrent herpetic infection occurs when latent HSV1, hiding in the trigeminal ganglion, becomes reactivated and causes small vesicles that quickly rupture to form painful ulcers on keratinized mucosa. The precipitating factors: fever, trauma, exposure to sunlight, stress, menstruation and immunosuppression. Prodromal phase occurs hours to 24 hours before lesions appear. Burning, tingling, itching, tightness in the area where the lesions will erupt. Occurs on keratinized, bound mucosa, attached gingiva, hard palate, vermilion border of the lip, cold sore. Rarely on non-keratinized mucosa. The lesion appears as cluster of tiny vesicles, which rupture rapidly leaving small shallow painful ulcers. Management during prodromal stage. Best time: acyclovir, valacyclovir, or famcillover. Topical: acyclovir, penciclovir. Pain and supportive care: analgesics, chlorhexidine mouth rinse. Avoid acidic, spicy food. Varicella zoster virus. Herpes zoster virus causes chickenpox. It appears as small ulcers surrounded by erythema accompanied by skin lesions. Wig presents as papules, which evolves into vesicles, pustules and scabs. Highly contagious, spread by droplets. The incubation period 14 to 21 days. Occurring primarily in children. Self-limiting. Treatment and management of chickenpox. General supportive care: paracetamol, acetaminophen. Do not use aspirin. Risk of Reyes syndrome. Avoid ibuprofen if possible. Risk of severe skin complications. Calamine lotion. Encourage plenty of fluids. Soft diet if oral lesions are painful. Antiviral therapy: acyclovir. Most effective if started within 24 hours of rash onset. Shingles is a reactivation of varicella zoster virus that remain dormant in sensory nerve ganglia after a past chickenpox infection. When reactivated, it causes painful, unilateral, vesicular eruptions along the distribution of the affected nerve, never crossing the midline. Affects elderly or immunosuppressed. Clear in 2 for weeks with scarring and pigmentations and is followed by severe post-herpetic neuralgia, which may last for years. Treated with systemic high dose of acyclovir 800 mg 5 times per day for 7 days. Systemic corticosteroids may be helpful in reducing incidence of post-herpetic neuralgia. Herpangina. Herpangina is an acute viral illness caused mainly by Coxsackia 7, 9, 16 viruses, presenting with small vesicles and ulcers in the posterior oral cavity, accompanied by fever and sore throat. It commonly affects children but can occur in adults. Characterized by pyrexia, dysphagia, sore throat and multiple small vesicles on the soft palate, and uvula which rupture leave superficial ulcers. There is no specific antiviral. Treatment is supportive. Supportive care: paracetamol, ibuprofen for pain and fever. Cold fluids, soft foods. Hydration. Topical anesthetics, for example, viscous lidocaine, with caution in children. Avoid spicy or acidic foods. Hand, foot and mouth disease. Common viral illness, caused by Coxsackie virus AE16, affecting mainly young children. Characterized by low-grade pyrexia, malaise, anorexia. Multiple shallow ulcers of the labial and buccal mucosa. Indistinguishable from primary herpetic gingivostomatitis although no gingival involvement. Management: supportive only, no specific antiviral. Fever and pain: paracetamol or ibuprofen. Oral pain: cold drinks, ice pops. Avoid acidic, spicy foods. Topical oral anesthetics, with caution in young children. Hydration: very important, especially if ulcers are painful. Skin lesions: keep clean and dry. No need for topical antibiotics unless infected. SCC is the most common oral cancer, 90%, rising from malignant transformation of oral squamous epithelium. It is aggressive, locally invasive, and capable of metastasis, mainly to cervical lymph nodes. Highly variable but often involves ulceration. Firm with raised edges, with an indurated, inflamed granular base and is fixed to surrounding tissues. Nicorandil is an anti-anginal drug used to treat stable angina. A well-known, but often overlooked adverse effect is the development of painful oral ulcers, which may be deep, persistent, and resistant to normal therapy. Resolve a couple of months after the drug has been stopped. The patient need to be referred to GP or cardiologist to stop the drug if possible and review the patient.